Hello, I'm Tex, and this is Tex Talks. If you haven't been here before, welcome to the spot. So today's actual subject is going to be not in the details yet. I'm going to get there, but it's about narcissistic personality disorder, NPD. I've been hearing more and more about that from people that come in and see me. It seems like a lot more of that is on the internet. I'd like to start off by saying I truly feel and empathize with anyone who has been subject to the bad ends of dealing with someone who has NPD or someone who just has certain narcissistic qualities that tend to be rough, that really tend to hurt others. And in that sense, I'm also not justifying what anyone does. I just want to take a look at things. And I'll take a look at it in the same context that I take a look at BPD, borderline personality disorder. For the longest time, if you've seen BPD on the internet, and even still to this day, if you see it, you hear some pretty rough things said about people who have BPD. And these are by people who have bumped into somebody with this diagnosis or characteristics related to this diagnosis in a person. And it's scary and it's frightening. It can be painful. It can leave you confused and bewildered. And over time, we started to realize that people with this diagnosis are also suffering. And as their problems come to light, we have now started to realize that there is a large population of people who have this diagnosis. People often hid this diagnosis. As I said in previous video, a lot of people were afraid to diagnose somebody with this because it was such a chronic, long-lasting, stigmatized condition that people, in the medical profession, in the health profession, mental health profession, would often diagnose someone as something else to get them into treatment. With that same thought in mind, I look at NPD and shy of someone who has antisocial personality disorder or even, heavier, deeper forms of psychopathy, sociopaths and psychopaths, NPD gets some real nasty labeling on the internet. And I'm sure that there are cases where this is rightly so. If you look, there is lots and lots of information and lots of stuff about surviving a relationship with someone with NPD. Lots and lots of information about recovering from narcissistic abuse. Even some of the terms used, malignant narcissism, they really put NPD in a rough light. And I think part of that come about as reaching out to people who were victims of narcissistic abuse to get them to get help, to help them in the situation they were in, to find resources, to do therapy, to do things. The thing is now is that, much like earlier in BPD, it has become the norm to see that. And if you look at actual help for someone who has NPD, you find that's very low. You go on in any bookstore, you look for books on it, trying to find a book that helps you deal with it if you have NPD is few and far between. Now, a lot of times people will say that's because people with NPD rarely look for help. Partially true. For some people with NPD, the frame of mind is, I don't need help. Everyone else is a problem. I'm not a problem. And some see it as they don't even know they have it. They just see that this is how their life works. And it isn't until the people around them have had so much and can't take it anymore. Family members are cutting them off. Spouses, boyfriends, girlfriends are leaving them, that they go, I guess I need to do something about this. So you have to think about that for a minute and go, is the stigma that we put on having NPD and the amount of basically anger that we throw at them actually going to help the situation? And I know this goes into a bigger conversation of screaming and yelling at people does not necessarily make them want to change their ways and be better. I've always said someone, in order to get help, needs to admit they need help or at least want help. And there's where it gets confusing with almost all the personality disorders and many diagnoses in general. It is knowing that you need help, knowing that inside of you, not just being told that by somebody else, but recognizing that and actually working with that, and then coming to grips with you got a problem and you need to work on it. And this tends to be doubly hard for someone with NPD to come forward and admit, I have a problem, I'm imperfect, I have an issue, and not blame things or push things to an external source, to have this external locus of control. And I've also done videos before, I know specifically on understanding, is this NPD or is this someone who's on the spectrum, ASD, autism spectrum disorder, because there are certain things that cross over. In fact, there are certain things that cross over with all the personality disorders, certain neurological things that go over, ways that you see and think, problems with impulse, all kinds of things. So figuring out if you think someone that you're with, that you care about, family member has NPD, screaming at them that they have NPD, just like screaming at them that they have BPD or any other personality disorder, is not going to make them go, oh, you're right, woe is me, let me go fix it. It's the same approach of talking to them and getting them to go seek help and letting a professional diagnose them and working through it. Many of the people that come in who have NPD are coming in for other problems, depression, OCD, substance or alcohol abuse, and personal problems. And it's getting them to a point where they can work with that and helping them get through that. That's where things are going. So I encourage you to encourage the people that you know that have that, if you still want to maintain a relationship with them, is to get help. And I also would say that take everything with a sort of middle path, that yes, people with NPD can do some truly horrendous things. Also, though, think about it for a minute. In our world, we encourage it. We actually look to people like that. We ask for guidance and help. We want those kinds of people to be in charge of things. We hire them in our companies to be in charge. They have a knack at working their way up. So obviously there's something that we want. And a lot of people, it's often said, have a certain level of self-preservation. And if you don't have a certain level of self-love, then it makes it very difficult for you to function, to do what you need to do. Everything in balance, everything working towards the middle, not too much, not too little. So, like I said, this isn't a video that neither condones or promotes any kind of behavior that hurts other people or hurts yourself. What this is a simple statement of we need to shift our thinking in that people with NPD need therapy, need help of whatever fashion, in the same way as people with any other personality disorder will need help or therapy in some fashion to obtain the kind of life that they want, the kind of life that the people they love want, and so that everybody can get along. Like I said, that's a start. I'll try to talk more about it in videos later on, along with giving you more videos on personality disorders in general. I hope you're having an awesome day. I hope everything's going well for you.